Mr. Aquino, can I come in?
Yes.
Thank you. I'm going to close the door for privacy and I'm going to disinfect my hands. And I'm going to sit down at the level of the patient.
Mm-hmm.
My name is Catherine. I'll be your attending nurse for today. How are you?
I'm good, thank you.
Okay, I'm here to collect data regarding your hospital visit today. Is that okay?
Mm-hmm.
Okay. And before we start, I would like to inform you that all the information you will provide will be kept confidential and be shared within the healthcare professional taking care of you. Is that okay?
Yes.
Okay. Can you tell me your full name and your date of birth, please?
I'm Christian Aquino, and my date of birth is March 4, 1979.
And how would you like to be
Just
addressed?
call me Christian.
Okay. Okay, Christian, can you tell me what brought you here today?
I have chest pain
Chest pain. And do you remember when did it start?
2 weeks ago.
And have you experienced chest pain before?
No.
Okay. Did you consult medical assistance when you felt the pain for the first time?
No, I just ignored it.
Okay. So what activities do you do when you notice that you are having chest pain?
I was climbing the stairs that time.
Okay. What do you do to manage the pain?
It usually goes away when I take a rest.
Mm-hmm. And do you take any medication for pain?
No.
Okay. And how long do you notice the pain will last before it goes?
Like 15 to 30 minutes.
Mm-hmm. And how do you describe the pain? Is it crushing, stabbing? Is it burning?
It's crushing.
Okay. And can you rate the pain from 0 is no pain and then 10 is the most painful you can ever imagine?
Like 5.
5. Okay. Is the pain made by worse? Is the pain made worse by moving the arms or neck?
No.
By breathing?
No.
By lying flat?
No.
Are you having chest pain right now?
No.
No. Okay. So you're only having chest pain when you're climbing the stairs. Okay. And can you show me the location of the pain?
Yes, I'm right.
Does it usually start on that side?
Yes.
Okay. Does the pain radiates to any other spot?
No.
Okay. And what do you believe it's causing the pain?
I think I might be having a heart attack.
Okay. And how does the pain affects your life?
Yeah, sometimes I get nervous because you never know when I will have a heart attack.
Yes, I understand how you feel, Christian. Are there any other symptoms like sweating,
No.
pale skin,
No.
heart skipping,
No.
nausea and vomiting?
No.
Um, are you having any shortness of breath?
Yes, like I've noticed that it is getting harder to me to breathe when I do exercise.
And what kind of exercises do you do?
Yeah, I do treadmill, walking in the treadmill.
Okay, and when do you notice it's getting harder to breathe when you start your exercise?
Yeah, like after 10 minutes of walking.
Mm-hmm. And does the shortness of breath come on unexpectedly?
Yes.
And does it come and go?
Yes.
Mm-hmm.
Yeah, like only when I do exercise.
Okay, and what are the things you do to manage your shortness of breath?
Yeah, I just take a rest and relax.
Mm-hmm. And have you awakened at night because of the shortness of breath?
No.
And are you having shortness of breath when lying down?
No.
Okay. And how many pillow do you use?
One pillow.
And how does the shortness of breath affects your activities of like daily
Yeah,
livings?
I won't be able to do my routine exercise like running, like lifting,
Mhm.
push-ups, and
Mhm.
pull-ups.
Okay. And do you have any cough at the moment?
No.
No. Okay. Do you seem to tire easily?
Yeah, I've noticed that I get tired more on at work.
And what is your work?
I'm a grade 1 teacher.
Is there any specific time of the day that you feel more tired?
Yes, in the afternoon.
Okay, and when does the fatigue start?
I think 2 weeks ago.
And are you able to keep up with your family and with your family members and coworkers?
Well, when I get home, I only wanted is to take a rest. I feel so bad that I'm not able to bond with my children anymore.
Mm-hmm. And how many children do you have?
I got 2.
2 children?
Yeah.
Okay, and how old are they?
3 years old and 2-year-old.
Mm-hmm. Yeah, it must be hard not to be able to give quality time with your children. I'd feel the same way as you do in your situation. Are you still okay to continue, Christian?
Yes.
Okay. Okay, moving forward. Do you notice any swelling of your feet and legs?
Yes, I noticed that my feet are swollen.
Are your both feet swollen?
Yes.
Mm-hmm. And when did you first start? When did you first notice this?
About a week ago.
A week ago?
Yeah.
Okay. And is there any recent change?
No.
And what time of the day does the swelling occur?
It results usually swell at the end of the day.
And how much swelling would you say there is?
Like my house slippers feel so tight when I wear it.
And does the swelling go away?
Yes, it goes away after at night sleep.
And do you notice any change of your color, like your nail beds turns blue?
No.
No. And do you wake up at night to pee?
Yes.
And how many times do you get up?
Twice.
And how long does it been happening?
About a week ago.
Okay. Now I'd like to move on and ask you some questions about your general health and your health history. Is that okay?
Yes.
Okay. Do you have any past or recent illnesses?
Yes, I do have a hypertension and a high cholesterol.
Okay. And when was it diagnosed?
Um, 2 years ago.
And what are the medications you're taking for
Mm.
hypertension?
Yeah, I am taking pills for high blood pressure, like and cholesterol. Like I am taking amlodipine for my high blood pressure and the Lipitor for my cholesterol.
And do you take any? Do you take it regularly?
Yes.
And is your blood pressure controlled at the moment?
Yes.
And do you check your blood pressure regularly?
Yes.
Okay. And when was your last visit to the doctor to check your labs such as cholesterol?
I think 2 months ago.
Okay. And have you ever had any heart attack before?
No.
And aside from amlodipine and Lipitor, are there any medications you are taking?
Just vitamins.
That just vitamins.
Yeah.
Okay. No over-the-counter medications.
No.
No herbal medications.
No.
And are you allergic to anything?
No.
Does any of your family history has hypertension and a high cholesterol?
Yeah. Yes. Yes. Both my mother and father has a high blood pressure and a cholesterol and diabetes.
Do you remember what age were they diagnosed?
No, I can't remember.
Okay. Okay, Christian. Can you please describe to me your usual diet?
Well, I am an Asian, so I eat rice and stir fries a lot.
And how often do you eat stir fries?
Like 3 times a day.
And how what about the rice?
3 times a day as
Three
well.
times, breakfast, lunch,
Yeah.
and dinner. Okay.
Yes.
And do you smoke?
Not anymore. I quit 2 years ago.
And how long did you smoke before you stopped smoking?
Probably 20 years.
Do you recall how many packs of cigarette you smoked
I think
before?
I consume 2 packs every day at a time.
Okay, and were there any challenges when you stopped smoking?
Yeah, I was determined to stop smoking, so there were no challenges. I started gradually and keep used not to smoking.
Mm-hmm. Do you drink alcohol?
Yeah, I drink wine.
And how often do you drink wine?
I only drink at dinner time,
And how much do you drink?
about a glass.
And how long have you been drinking wine?
20 years.
Okay, Christian. I think I've covered all the data needed. Is there anything else you would like to mention?
No, so far no.
No? Okay. I am going to submit this information to the doctor who are attending you and he'll be here soon. Are there any questions you would like to ask?
No.
Anything you need before I leave?
No.
Okay. Thank you very much, Christian, and it was so nice meeting you.
Thank you.